This is Module 23, Cognition and Mental Health. These are the concept learning outcomes, or your objectives. The concept of cognition is a complex set of mental activities through which individuals acquire, process, store, retrieve, and use information. It involves many processes: being aware, remembering, reasoning, decision-making, understanding, using language. Normal cognition is the result of several factors. Anatomically and physiologically, the central nervous system must be intact. It must be sound and working optimally. Individuals must have progressed through one or more stages of cognitive development. We talked a little bit about the cognitive development when we talked about overall development. Some genetic considerations and non-modifiable risk factors. Cognitive skills become increasingly complex from childhood through adulthood. Changes in cognition experienced by older adults, they may be minor. They may be periods of time of forgetfulness or memory lapses. The timing and the degree of changes varies from person to person. Most age-related changes are minor, and a significant decline in cognitive functioning is not inevitable and not a normal part of aging. So just because somebody is elderly or an older adult does not mean that they will have changes or a decline in their cognitive functioning. They will have times that they may be forgetful, have temporary memory loss, but it is not an inevitable part of aging. So alterations in cognition, we have, remember, your cognition is your thoughts, your feelings, perceptions, behaviors, and some abnormal alterations to cognition include psychosis, which is an abnormal mental state. You can have delusions, which are rigid false beliefs, such as the patient thinking that the healthcare workers are government spies. Hallucinations, imaginary sensory experiences, either seeing or hearing things that others don't. Illusions are distorted perceptions of actual sight, sound, and other stimuli, such as a shadow looking like an angel or an IV alarm pump being a telephone. Learning disabilities you are going to cover in pediatrics, but just be aware that learning disabilities are reduced functioning of verbal, linguistic, reasoning, and academic skills. Causes may be very complex, and it's usually not diagnosed until a child is old enough to be able to read or write. There are some genetic considerations and non-modifiable risk factors. There may be no evident cause. Individuals in a family with reading disabilities are likely to be affected. So again, when you're doing your health history, this is where you need to find out if there's a family history of any learning disabilities. Prevention, the nurse plays a large role. You need to assess the child for developmental milestones and work with the family to plan for the child's needs. And that's why you do need to know these developmental milestones, but you're going to get those in pediatrics. But just be aware that they're what guide your assessment for younger children. Intellectual disabilities, there are some genetic considerations and non-modifiable risk factors. Any condition that inhibits the brain development before birth, during birth, or in early childhood years. Many are non-modifiable factors, things such as inherited genetic disorders, Down syndrome, prenatal genetic abnormalities. There is fetal alcohol syndrome, Fragile X, ADHD, autism. So we need to screen individuals for intellectual disability and related conditions. Make sure that the parents are getting genetic counseling. Early neurologic screenings for premature and low birth weight infants are usually done. And we also want to make sure that we're monitoring for signs of abuse. Sometimes they can be manifested in as an intellectual disability. Dementia is something that is not reversible. It's a progressive loss of cognitive function. It affects many critical functions. The individual loses the ability to solve problems. They may experience personality changes. Again, it is not a normal part of aging. Many diseases may cause dementia, such as any of your neurologic diseases. Parkinson's is one example. Alterations and manifestations, conditions that mimic dementia. Age-related cognitive decline. You forget where you put something. You have these temporary memory lapses. You forget somebody's name that you know very well. Mild cognitive impairment, depression, or other emotional problems can also manifest itself as being very similar to dementia. Delirium is a dementia that has a specific cause. So it is usually acute, and often it's a side effect of medications or an acute disease. It's reversible. If we treat the source, then the delirium goes away. So dementia is reversible and delirium is not. So the prevalence in the US in 2016, more than 5 million Americans are diagnosed and living with Alzheimer's disease. This is one of the most severe forms of dementia. Some genetic considerations and non-modifiable risk factors: inheritable gene mutations, age, gender, diabetes, Parkinson's, multiple sclerosis, Down syndrome, kidney disease, HIV. So what can we do to prevent dementia? There are medical conditions that are preventable or remediable if they're kept under control, such as cardiovascular disease, diabetes. So even though somebody has these illnesses or disease processes, if they keep the symptoms under control, they don't necessarily have to develop dementia. Environmental, psychological, and interpersonal traits and behaviors, such as the effects of head trauma. Do your patients use personal protective equipment? Depression in older adults, nutrition and weight gain. There is a link between vitamins and antioxidants and our cognitive function. Regular social activity prevents depression. There is no specific screening due to the many different kinds of causes of dementia. Something that we can have our patients do is to make sure that they are continually using mental games if they are not in nursing school and using their brain to the max. Things like reading, doing puzzles, that type of thing is very helpful. So our assessment. So many of the assessments are genetic or condition specific. It is part of your physical exam, and you're going to make sure that you always assess older adults for depression. Depression is extremely important when it comes to older adults. There are things such as the geriatric depression scale, mini mental state exam, where you have a standard form, a screening tool that looks at language and memory, often used in older adults. So mental status assessment, there are different forms that you can use that will assess things such as language ability, orientation, memory, if they're able to do simple math, moods, emotions, perceptions, and they can actually come up with a score then to make it a little more objective. Cultural and lifespan considerations. Individuals with known intellectual disability may be able to answer some questions. So just because they have an intellectual disability, don't always rely on a caregiver. Nurses must understand the pediatric client's level of cognition, again, the developmental stages. Remember that not all clients are proficient in English. They may not understand the terminology you're using. Physical limitations such as hearing or speech deficiencies can also be a concern. Make sure that you're creating a safe environment. Make sure that you are providing education to caregivers, parents, schools. We want to preserve the client's dignity. There are community resources, things such as Medicare, Medicaid, Social Security, Disability, our federal government resources. At the state and local level, we have early intervention services, and then you have your advocacy groups, things such as the Alzheimer's Association, American Association on Intellectual and Developmental Disabilities. They can provide referrals to specialists and also support groups. So that is the end of Module 23, Cognition and Mental Health.